Hi guys, so I'll be speaking on soft tissue sarcomas. They are a group of malignant tissues that arise, or malignant tumors that arise from connective tissues. Connective tissues involving the muscle, fat, fibrous tissue, blood vessels, and nerves. They are commonly found in the extremities, most commonly at the thigh and gluteal regions, but you can also find them at the trunk. You can find them at the retroperitoneal region. You can find them at the neck and head and neck. So the histological subtypes could include liposarcoma, leiomyosarcomas, rhabdomyosarcomas. When I say leiomyosarcomas, they involve smooth muscles. Then rhabdomyosarcomas involving skeletal muscles. Then you can have also fibrosarcomas and angiosarcomas. So the pathophysiology of this condition is the fact that these cells arise from stem cells of the connective tissue. So when they arise, they begin to proliferate, and when they proliferate, there's a mutation that happens that leads to their proliferation. They proliferate, enlarge, and begin to invade the tissue in which they are involved. So this growth is uncontrolled, which leads them to invade the tissues in which they are present in, and they can present in different ways. That's as a role their clinical presentation. Now they can present as painless swelling that is continuously enlarging in the tissue or in the part of the body where it is found, and this mass can actually grow to ulcerate the overlying skin, and it can also invade to become fixated to the underlying structures, and they can also compress the surrounding nerve or blood vessels that is within that vicinity and become painful. So this condition, when it happens, you can decide to, when you want to diagnose, you can actually, from clinical examination, make your assumption this is a soft tissue sarcoma. Then you can now go ahead to make your diagnosis. You do an MRI. Your MRI helps you to determine the local extent of the disease. You want to identify the involvement, the fixation to other surrounding tissues, fascias, muscles, and all that. Then you can do a CT. The CT helps you to stage the tumor. So you're doing a CT that will involve the chest. So you're doing like a chest CT to help you determine for any form of metastasis. So metastasis, because it's the lungs is the commonest location where this tumor metastasizes to, but it can also metastasize to the liver, to bones, and other parts of the body. So the mainstay in the management of soft tissue sarcomas is to, in fact, as diagnosis, you can also do a biopsy, which is very, very important. So the biopsy here is done for histology, then immunohistochemistry. This is to help grade the tumor and also to confirm and make a definitive diagnosis of this tumor. So the management mainstay is surgical excision. So you do a wide local excision with greater than 2 cm margin of this tumor. So with this, you can after which, if there's a positive margin still left, you can decide to do a radiotherapy. But you can also do a pre-operative radiotherapy as well as a post-operative radiotherapy. After the surgical excision, you can now go ahead and give chemotherapy to this patient. Chemotherapies commonly used are like gemcitabine, the phosphamide, the zorubicin. They are the common chemotherapies that use. The prognosis of this condition is usually not very good, but it's based on the tumor grade. It's based on the size of the tumor. Tumors greater than 5 cm are believed to be very, very aggressive. And also the margin, the margin, if there's a positive margin, then the rate of recurrence is very high, and the histological subtype of this tumor. So with this brief talk on soft tissue sarcoma, I think you've been able to learn about this topic. I want you to please kindly subscribe to my channels for more information and more topics. Thank you.